this is probably one of the most interesting differences. Very minute, but very relevant differences between countries. What I'm holding here is the Canadian Polysporin. As a licensed pharmaphile in 4 states, I like to go to other countries and see what kind of medications they have. And this one, to me, is one of the most exciting things to come out of Canada since Neil Young. This is an antibiotic cream, but it's very special, and I'll talk about that here now. We cannot get this in the United States because one of the chemicals is not something you can buy even with a prescription in the United States. However, we do have Polysporin, but the American version is different. This is very difficult, I think, for people to understand because they see the same name and they think it's the same thing. But it's a completely different country. You can do whatever you want in another country. And this concept actually we see even within the United States. I mean, Mucinex makes several different products, all with different active ingredients. So here we have, in my opinion, one of the best products you can buy. Now, I was able to find after the fact you can import this from Canada on Amazon. But you cannot just like walk into a pharmacy and buy this in the United States. Heals Fast formula. Should I pronounce the French parts? JK, I will not. Doctor recommended it. Number 1. Extra infection protection plus pain relief. Yes. We'd love to see it. And of course, this is Polysporin. Prevents infection, helps speed healing, minimizes scarring. From looking at a lot of Canadian products, I've been able to deduce that they have to put the French translation on these, which is very nice, I guess, for the French-speaking population. However, it makes the package so convoluted. My goodness, look at all this. I mean, there is an incentive to put less information on here because you have to translate it. It's very, very time consuming. Now let's look at this. This is Johnson & Johnson from Canada. And where this is different is in the active ingredients. First one, polymyxin B. We have that in the United States. I believe Neosporin has polymyxin B in it. Bacitracin. I believe Neosporin also has bacitracin. And you can actually buy a bacitracin ointment by itself, like just pure bacitracin. And in fact, I believe those first two, the ones I just mentioned there, is what would be in Polysporin if you were to buy this in the United States. However, this was not bought in the United States. This was bought in Canada. this is also an antibiotic. So there's 3 antibiotics in here. And if you buy Neosporin or a triple antibiotic ointment, you will have polymyxin, bacitracin, and neomycin. But the Canadian version, instead of, well, I guess it's not really the Canadian version of Neosporin, but this Polysporin from Canada has a polymyxin, bacitracin, and gramicidin. And we do not have gramicidin in the United States, hence this product is not able to be purchased. I was able to smuggle this into the United States by bribing the border guard. I'm just kidding, you can bring it into the United States. In fact, pretty much anything you can buy in a different country you can bring back into the United States as long as it is not a controlled substance. If you bring a controlled substance across the border, you will get a massive fine if they find out. Now, gramicidin is really, really cool. What this does is it's like a kind of an amino acid structure. And in the bacterial cell, the gramicidin kind of shoves itself into the cell wall. And it creates a funnel. It creates an opening. And the contents of the bacterial cell just kind of fall out through that funnel. Isn't that cool? So it's like you're like sticking a funnel into your skin, and just like everything falls out. And of course the bacteria then dies after that. Now, here's another thing. This also has lidocaine in here. And lidocaine you can buy in the United States, that's not an issue. But I've never really understood this. In the United States, lidocaine 4% cream for your skin you can buy without a prescription. But the 5% for your skin in the United States, you need a prescription. This is 5%. And what makes things even more stupider is you can buy lidocaine 5% in the United States without a prescription. But it's only the hemorrhoid cream. I have no idea why. Isn't that the weird? Like, none of medication law makes no sense. Or I guess regulation, rather. I've often said, you're dumb if you try to understand it, because nothing just ever makes sense. I just don't know. I wish we had this. Now we do, like I said, we do have the lidocaine 4% cream that you can put on your skin. And I think that I have seen like a Neosporin with lidocaine product before, but it's not popular. I mean, that should be the default. You would want a pain chemical for a cut in your antibiotic cream. So if I was in charge, and it's a good thing I'm not in charge because everything would be perfect, our standard antibiotic creams would have lidocaine in it. And I just really don't know why. protection and aid healing of minor cuts, scrapes, and burns. It temporarily relieves pain and or itching due to minor cuts, scrapes, burns, sunburn, insect bites, and minor skin irritation. Now doesn't that sound like something you would want a numbing pink cream for? You would want the lidocaine part. I don't know. There's so much that's wrong with this country, the United States that is. And someone should fix it. Another important part here, I've noticed that the Canadian packaging is very similar to the United States. They have to have the ingredients here and the purpose, and then there's directions, and they have to be in like easy to understand English, which is very similar to the United States. We'll get to that soon. Ask a doctor or a pharmacist before use if you have deep or puncture wounds, animal bites, serious burns, are pregnant or breastfeeding, yes, especially animal bites. Those require heavy-duty antibiotics a lot of the time. When using this product, avoid contact with eyes. If contact occurs, rinse with water. Stop use and ask a doctor if irritation occurs. New symptoms appear. The condition gets worse, lasts longer than 7 days, or recurs within a few days. I have a philosophical question. What's the difference between recurring and reoccurring? I've always wondered that. You experience... Wait, that's very difficult. Oh, it has... Oh my gosh, so these are circles. Okay. And then the next one is a square. So it's like I guess a semicolon kinda. So that's difficult to read really. You experience weakness, confusion, headache, difficulty breathing, pale gray. They spelled gray differently. We would spell G-R-A-Y, wouldn't we? Gray or blue color. They spelled color differently. That's Canadian. Oh my gosh, I love it. Colored skin. Keep her out of reach of children if swallowed. Go poison control sentry. Or get medical help right away. This is so cool. I love the subtle nuance that countries, like the subtle differences between countries. I think it's so cool. Directions. Adults and children 2 years and older. Clean affected area. Apply a small amount of this product on the area 1 to 3 times a day as required. May be covered with sterile bandage. For children 2 to 12 years, application should be supervised by an adult. Do not use more than directed. Wow, interesting. Other information stored at 15 to 30 Celsius, like anyone knows what that means. It's like 1,000 degrees probably. Inactive ingredients: cocoa butter, cottonseed oil, olive oil, petrolatum. And that is petrolatum, by the way. It's not petroleum. Although the difference is not really relevant, but that is how you pronounce that. Sodium pyruvate, vitamin E. Should I call this number? Be honest. Should I? No, probably not. Look, questions is the same in French, apparently. When I went across the border to buy this, the Canadian border guard said, "Bonjour." And I was like, okay, we can spare the theatrics, I think. Anyway, let's open this bad boy up. That was a nice clean break, I like it. Wow. This is way fatter than I imagined. Expiration date is February 2028. Interesting. It's got the same directions here. It's got the dosage here as well. Markham, Canada. Does anyone know where that is? I sure don't. Oh, Johnson & Johnson. Okay, let's see if I can take this off without looking like an idiot. I sure did. Alright. What is the difference between a cream and an ointment? There are differences, however, it's very inconsequential for the most part, but dissolvability is going to be different. It sounds like, when you first think, what is the difference between a cream and an ointment, it sounds like it doesn't matter. And for the most part, it does not. But an ointment is much more oily, and that affects dissolvability of the active ingredients. That also affects penetration in the skin, because you have fat underneath your skin. Typically, fat things are absorbed better. But realistically, in the real world, no one really cares about the difference, and it's not relevant. However, where people make a very common mistake is that they assume that the price is the same. And because, like I said, realistically, in the real world, it really doesn't matter. But in the United States, at least, I don't know about Canada, if you have an ointment of something and a cream of something, they are considered two different products. They might as well, even if the active ingredient is the same, they might as well just be two completely different things. And because of that, drug manufacturers in the U.S. will change the price of them, sometimes pretty considerably. Triamcinolone is a good example. Triamcinolone is a steroid cream, and it's also an ointment. And I don't remember which one off the top of my head is just like ridiculously expensive, but for some reason it is. And nobody is going around thinking, oh, I better check to see the price of this triamcinolone 0.025% ointment, whenever I know that the 0.5% cream is very cheap, So, again, going back to what I was saying earlier, you're dumb if you try to understand it. And there's no rules. People just do whatever they want. And you just have to learn what's going on and be aware of it. Anyway, back to this. Polysporin. So this is an ointment. Now whenever I squeeze this out of this tube, I expect it to be very greasy. Very, very greasy. Yep. Look at that. It really does look like Neosporin, doesn't it? Doesn't smell like anything, so that's cool. But you can tell as I kind of massage this what's so special about